Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Sunday morning. With us today is Dr. Peter Michalos. And live long and prosper. But we want to live long and prosper as long as we have our brains. Well, Dr. Michalos, what do you have in mind today?
Well, today, John, we're going to talk about a really exciting topic. And the master control center in our lives is our brain. And without a good brain, it's hard to function well in life. And we've all often talked about the modifiable risk factors of keeping your brain healthy, like Mediterranean diet, social engagement, don't smoke, limiting alcohol, trying to sleep 8 hours, and walking, swimming, because they don't beat up your joints but keeps the blood flow in your brain going, eating green leafy vegetables because that boosts our nitric oxide, which helps keep blood flow to our brain better, controlling the high blood pressure, eating berries, nuts, fish oil, olive oil, and, trying to stick to lean proteins and really trying to avoid red meat and sugar and avoiding processed foods. But one of the things that's also modifiable, which turns out to be very important, is the oral microbiome. And I had a discussion with leading prosthodontist Robert Ciccarelli and periodontist Adam Baer, and the discussion was about finding that in the oral microbiome there's a bacteria called P. gingivalis that they found, and it also produces a toxin called gingipains. And they found that 90 to 100% of the brains with Alzheimer's disease had this gingipain toxins in there, and that the spinal taps sometimes done on Alzheimer's patients, they found this P. gingivalis bacteria. So it turns out that keeping the dental plaque away from your teeth and minimizing the bad bacteria helps to prevent Alzheimer's disease, because there seems to be a mouth-brain axis where these bacteria, through gum disease, especially gums that are bleeding, get into the bloodstream, and it passes the blood-brain barrier, gets in the brain, causes inflammation, and makes up these things called amyloid plaques, which are associated with Alzheimer's disease.
Let me ask a quick question.
Sure.
If you take care of yourself better, whatever you had from the previous, does it go away slowly?
Well, the less, because you have less inflammation. Because if you have less bacteria, your body does not have as much neuroinflammation. And that's one of the other things is using like a prebiotic toothpaste, which feeds the good bacteria. That also may play a role in keeping your oral microbiome. And it generates gases that come out of our gut and our mouth. And in the future, there's even a company doing a test where they analyze the breath. Rua Diagnostics has this breath scan they're developing, and it'll actually, you puff into it, and it's going to tell you what good bacteria, bad bacteria, gases are coming out to even diagnose certain bacterial overgrowth, and that's the future of medicine. And then another very exciting area, I had a discussion with one of the top neurosurgeons in the country, Dimitri Sagunas at George Washington University in Washington, D.C., and what they're finding is that the brain also can get other problems like aneurysms, AV malformation, which is an abnormal tuft of blood vessels. And one of the big topics now is neuroendovascular surgery, where if you get a brain bleed, these things called chronic hematoma, that affects 17 out of 100,000 people in the United States, and it affects about 100 people, 100 out of 100,000 of people over 65 to 80 years old, and they get these recurrent bleeds in the brain. In the old days, you had to go with surgery, crack the skull, and get in. But now they go through your arm or your leg with these endovascular techniques, and they can actually find this spot that's bleeding. And one of the common ones is called the middle meningeal artery, and they shoot in this foam, and they can actually stop the bleeding without even having to go to the operating room, which is quite amazing. And they're finding that the incidence of these brain bleeds called subdural hematomas is increasing in the United States. Why? Because so many people are taking blood thinners for a lot of different conditions and heart conditions, and that increases your risk of brain bleed. So, of course, wearing a helmet if you're doing bicycling, motorcycling, very important. And even if you're walking out in the ice, just wearing one of those regular hats or wool hats that's a little thicker gives you some protection if, God forbid, you have a fall and you hit and injure your head. And, of course, wearing your seatbelt and having a good car that has a 5-star crash rating on both front and side protection is extremely important. And the other very fascinating thing they found is the ARIDS formula, which is plant-based pigments, lutein, zeaxanthin, vitamin C, zinc, and copper, which is a vitamin called the ARIDS formula. People who took that had 25% macular degeneration, and they found that taking those vitamins also helped improve the gut microbiome, increase the diversity, and those people had less macular degeneration. And the brain and the eye is an extension of the brain, so it probably helps the brain as well. So having a diet, a good diet, and fasting, as we've talked about, helps you heal and repair. Eating fish, legumes, which are lentils and peas, and eating some of those really good Goya beans, all those things turn out to be good for the eye, good for the brain. So these are things you can do to protect your eye and your brain, and you continue to get a greater chance of living to be 100 if you keep listening to WABC.
Thank you so much, Dr. Peter Michalos, and live long and prosper. And I hope all our listeners live longer so they can listen to WABC for a long time.
Thank you for always getting the truth out and getting all the front information in medicine.